Focus on Aging Adults is sponsored in part by AARP.
Our story begins more than 60 years ago inside an abandoned chicken coop where our founder discovered a retired teacher living, no home, no health care. So she said no to this injustice and yes to transforming lives. It's this drive, this compassion that inspired AARP. Today, we empower people to choose how they live as they age. We advocate for health and financial security. We strengthen communities everywhere. We are AARP Pennsylvania, creating real possibilities.
Pennsylvania has one of the largest aging populations in the country. Our aging adults are vibrant, active contributors to our society. PCN, in partnership with AARP, present Focus on Aging Adults.
Welcome to Focus on Aging Adults. I'm Larry Casper. This program is brought to you in partnership between PCN and the AARP of Pennsylvania. Our guests are Bill Johnston Walsh, State Director of AARP Pennsylvania, Kevin Hancock, Special Assistant to the Secretary of Aging, and the Secretary of Aging himself, Jason Kavulich. Welcome, gentlemen. The month of May is Older Americans Month. What would you like Pennsylvanians to do to mark the occasion?
Well, I think it's important for us to think about the contribution that older Pennsylvanians have made to our communities and to honor them in ways that we see fit and ways that are meaningful. It's great to volunteer for Meals on Wheels. It's great to volunteer in the community in large, impactful ways. But it's more important to be a good neighbor, to think about the people that live in your neighborhoods and your communities and do simple tasks. Help them with their yard work. Help them cut their grass. Work with them and see if they need help getting their garbage out or their trash cans brought in after the DPW comes to pick them up. Those little things really do make a big difference in a community, and it helps individuals in their communities stay in their homes. It helps keep them safe. It also helps them keep away from injuries, which oftentimes happen when things like that are occurring. So while I know it's important that we honor them, we volunteer, we support these organizations in our community that help bring services to people, it's also important to be good neighbors and focus on living with older adults in our communities as community members.
And I think the other piece, too, is that you have to remember that these people have a history, that they can give back to the community as well. They had jobs, they may be retired now, but they have a lot to give back. History, dealing with grandchildren, dealing with their neighbors. And I agree with the Secretary. Just remembering that, we keep them in the community as long as possible in their homes.
How would you like to increase awareness of the issues during Older Americans Month? This just strikes me as a good opportunity to get the word out.
Well, I think shows like this and other events that we have in the community are always important, whether it be in the month of May or any time, to talk about older Americans and talk about their needs and talk about what we do to make sure that they can live safely, that they can age in place, that we can make sure that they can choose to live where they want to live and have the resources to do so and the services to do so.
Now, what kind of events might you suggest? Now, you already told us about the value of just doing everyday necessary tasks, but what about events that will tend to attract people? Any ideas?
Well, any community event. You think about all the things that we do in our communities to bring people out, to bring people downtown. We look at what's happening at senior centers. We look at what's happening in terms of community celebrations all over the place. Every time there's an event in the community, there's an opportunity to celebrate older Americans, an opportunity to highlight the contributions that they've made to where we live and to make sure we celebrate it and honor it.
And I think the key thing, too, is at those events, remember your neighbor. If they don't have a way to get to that event, ask them, would you like to go to that? We'd love for you to come down and be back in the community and experience, your neighbors.
Kevin, we haven't heard from you yet. Tell us more about your position within the Department of Aging.
Sure. I am a special advisor for the Secretary, and I'm grateful for the opportunity. I've had an opportunity to work with older adults and adults with disabilities for a number of years in the Pennsylvania Medicaid program and also supporting the Department of Aging in my history. My work here will be, and I think we're going to be talking about this a little bit later, supporting and managing the project for Pennsylvania's efforts to develop a 10-year strategic plan or a master plan for aging and disabilities, and really looking forward to highlighting that work and what will be a stakeholder-driven process to identify our goals, objectives, and priorities for older adults and individuals with disabilities across the state.
Now, it's interesting to consider that Older Americans Month was established way back in 1963. How have times changed for older adults since then?
I think the issues that older adults face have become more complicated, and we continue to see things get more complicated, from the scams and the attempts to defraud them that are so prevalent, all the way down to just what it takes to live in a community. The expenses involved now. We are a very tech-driven world. So all things are tech. Either on your phone or on your device. So there's challenges that weren't there in the 60s that have evolved over time, that have made life more convenient for all of us. But sometimes individuals have difficulty and don't necessarily have the skills right at hand to work through them.
And I think the other piece of that, too, is back in 1963, you visualize someone that was an older American just sitting on their porch in a rocker. And that's not the case anymore. We have very active older Pennsylvanians here that even senior centers, they've gone from playing bingo to having yoga or Tai Chi, to really keeping up with the times and what people want. We have a lot of older Pennsylvanians that are still working. They haven't retired. We have that piece of it. We have older Pennsylvanians, quite a few of them that are raising grandchildren now. So they thought that my job of being a parent is over. It isn't. They're raising grandchildren at this point for a whole host of reasons. Travel, they're not sitting in home, they're not sedentary, they're getting out and about, and they're volunteering, going back to what the Secretary was talking about. They're out there. We have 1.8 million members here in Pennsylvania for AARP, and we have about 400 active volunteers that give every day, giving back to the community and to the members.
And Bill, let me add one thing to this excellent list you just enumerated, the fact that people are living longer nowadays, aren't they? So that has a certain, that puts pressure on a society to come up with things.
That's exactly right. And I'm sure, Kevin and the Secretary will be talking more about this, but the bottom line here is that we do have more older Pennsylvanians, more older Americans, and they're not all, some are doing quite well, but some need a little bit of help. And so there's programs out there that have been, especially here in Pennsylvania, because we have the lottery fund, and have been able to be supportive of the programs that we have. But we need to be focused on those, and I think the master plan on aging over the next 10 years will be able to look at that and look at what the needs are of this growing aging population in Pennsylvania.
Now, Pennsylvania is ranked number 5 for its aging population. So are there any theories as to why that is? Is it a matter of people staying here, staying put, or maybe they're moving here?
Pennsylvania is one of 2 states historically that have had people wanting to stay here. The other state is actually Louisiana. So Pennsylvania has always had a long history of people wanting to live here their entire lives.
What do we have in common with Louisiana, I wonder?
That's also a very good question. I think we have access to a lot of different waterways, but other than that, I think Pennsylvania is pretty unique in its own offerings for older adults to want to be able to stay here. There's just a sense of community that people seem to want to invest in here.
And I think the other piece is that we've seen twofold. One is that it's a great place to age in place, stay with your families. There's also a lot of fiscal pieces of why you'd want to stay here. There's no Social Security tax on, for Pennsylvanians, and some other pieces there. And then what we've been seeing is that there have been a lot of snowbirds, as we used to call them, people going down to the south, to Florida, to some other sunshine states, Arizona, but they always come back. They're down there for a little bit, but we've been seeing a trend, them coming back, wanting to be with their families as they grow older.
So fewer snowbirds nowadays.
Oh, well, there's still snowbirds, but they're coming back. They still leave, but they come back.
So, Bill, you brought up something called the Master Plan for Aging and Disabilities. Now, Master Plan certainly sounds ambitious, so I want to hear more about that.
Well, the priority right now is to build the state master plan for aging and disabilities, and as Kevin highlighted, it is a strategic plan built by stakeholders. It's going to be built for Pennsylvanians by Pennsylvanians. And this plan will be our roadmap for the next 10 years to really focus on what we need to help individuals age in place in their communities safely with the dignity and respect that they deserve. This plan will be heavily driven by stakeholders. We will be in every community in Pennsylvania. It's looking for input, looking for older Pennsylvanians to tell us and give us information as to how we need to build this plan out, what exactly they're looking for in terms of services and other avenues to make sure that they can stay in their communities, and really engage with them and listen to them. I think really one of the most important parts of this exercise is what we intend to do with listening sessions in 67 counties. That with the help of the 52 area agencies on aging, with the help of the Centers for Independent Living, we intend to have listening sessions. We intend to use our resources and partner with partners like AARP to make sure that we're having forums so that people feel that they've contributed to this plan.
Do you have a calendar yet for your listening tour?
We do not. It's in development, but we're looking at probably having a launch session as early as the 25th of May.
Right, and the listening sessions will be, as the Secretary mentioned, across the state. Every area agency on aging will be having multiple listening sessions in their areas. And the plan at this point is to begin in June timeframe and carry those listening sessions at least till September, if not longer. And stakeholders, what we mean by stakeholders include older adults themselves, adults with disabilities, their caregivers and care partners, and any other organization, individual, or entity with a voice that has ideas to improve the quality of life for older adults and adults with disabilities in the state.
So this master plan, as you call it, is still being devised as we speak, and a lot of it will be based on interaction you have with the community at these listening stops. And are you going to attend these listening tours, Mr. Secretary?
I will attend as many as I possibly can, but given the breadth and the size of the state and the fact that we want to make sure that we do our due diligence, we're going to have to divide and conquer and make sure that we're out as a department supporting the 52 area agencies on aging, supporting the Centers for Independent Living, to make sure that we hear as many individuals as we possibly can.
And I think the other piece from AARP's perspective is we want to thank Governor Shapiro for putting this forward, having the Secretary, having Kevin really push this. There's 5 other states, I think, at this moment in time that have some type of master plan, and I just think it's important for us to be able to have this transparency. I love the idea that the Secretary and Kevin, talk about all these stakeholders, getting everyone involved because it's their future as well. We need to be able to look at what our needs are as we go forward, and then what are the needs legislatively or in policy that we're going to need with this aging and disabled group as we move forward.
And I'm sure you're able to anticipate some of the concerns that are going to come up during this listening tour. So what's at the top of your list now? If you had to prepare for a listening tour tomorrow, what would you study today?
I think that we would, so the most frequently discussed challenges that face older adults and adults with disabilities relate to the direct care workforce and the healthcare workforce, and some of the gaps that we see in the healthcare and the long-term care industry. Another opportunity is housing. Every state, the 5 states that Bill had mentioned that have developed master plans have all had to talk about housing, but they've had to talk about housing in different ways. The 5 states include California, Massachusetts, Minnesota, Colorado, and Texas. They all have different issues with housing. Pennsylvania's own challenge with housing, as we know, is that we have a lot of housing stock, but a lot of it is either not affordable or it's not easily adaptive to adults with disabilities or with higher needs in their homes. And we want to be able to address those challenges to make sure that people can age in place and age in their communities in the way that they want to.
And I have a hunch you'll be hearing about property taxes, because we hear about that here at PCN all the time.
We definitely hear about it at AARP with our members. And I think that's an important thing to look at. If we're trying to keep people in their homes as long as possible, because that's where they want to age in place, we're going to have to look at property taxes as we move forward.
And there's news on property taxes. In other words, Governor Shapiro has a budget where he wants to increase the rebates for paying property taxes. What do we know about that detail-wise?
I know that the governor has very graciously and generously has looked to older adults and looked at making sure that there's an investment in older adult services and in programs like the property tax and rent rebate program. This is a huge expansion. This is something that has been needed for years. It's going to impact at least 175,000 older Pennsylvanians, and it's going to allow them to do things with those dollars that really are meaningful. A lot of people depend on that rebate rebate to pay for their insurance. A lot of people use that for prescription coverage gaps. It's a very important and impactful program. We are very excited that the governor's budget has proposed this increase. Its impact will be tremendous and will really impact the lives of thousands of people. Also, in his proposal, he has looked to expand our options program and help us, in the 52 area agencies on aging, tackle some of the challenges in the direct care workforce.
What is that, Jason? Why do you call it the options program?
The options program is a program that we have that's completely lottery funded. It works through the Department of Aging and the 52 area agencies on aging. And these programs provide personal care services or adult day services to older adults that would not necessarily gravitate to the level to be on waiver services. But we want to make sure that everybody has an opportunity to have these services, so they're not solely dependent on a person's income. So there may be a cost share associated with these services for an individual, but the bottom line is the department and the 52 area agencies on aging want to make sure that we're serving everyone, and that's primarily what these lottery dollars help us do. These dollars will help the agencies hopefully secure more direct workers to have personal care services. These dollars will also help the area agencies on aging with their waiting list for services and hopefully knock down their waiting list so that there's not so many individuals waiting for services in their communities. And they're also helping area agencies on aging onboard the staff that's necessary to run their organizations so that they can manage the services going into older Pennsylvanians' homes. The other portion of the budget request is to expand our senior center grant program. Right now, we have a $2 million competitive grant cycle for senior center grants. The expansion will be an additional $1 million that will help us fund a non-competitive grant cycle. That will help us make sure that senior centers, smaller centers, sometimes rural centers that really depend on volunteers, like the volunteers that we all talked about today, to run them and to make sure that they're functional and the resource that they are in the communities, will be able to make application and receive a steady amount of funds to help with making repairs or improvements or buying new technology or new equipment to make sure they have activities that are attracting people and keeping people engaged with the centers in their communities.
And I think, just want to go back for a second. First of all, AARP supports all three of those initiatives that the Secretary just talked about. One of the key pieces, I think, of the property tax and rent rebate is obviously, besides getting the rebate up to get more people engaged, and then the other piece would be there's a cost of living adjustment. Right now, what happens, happens with our PACE program or our pharmaceutical program. For older Pennsylvanians, it also happens, on the property tax and rent rebate program, is where you get a bump up in your Social Security and then you get knocked off, and that can impact almost 400,000 Pennsylvanians every time that happens. So this will be able to give us that cost of living adjustment that's needed so that people will not be bumped off the program.
Let me share some numbers with our viewers that have to do with Governor Shapiro's proposal for the property tax rebate plan. He's proposing to raise the maximum property tax rebate from $650 to $1,000. And just how significant is that extra $350?
It's huge.
Is it huge? Now I'm counting on you fellows to put it in perspective of the average senior Pennsylvanian's budget.
So basically, what we hear constantly is, people are trying to keep their homes. They worked hard all their lives. They're basically living in their homes. They're paying property tax that usually is going up. They pay utilities that are always, being, raised back and forth there. And so they really need those extra dollars. Yes, their Social Security may go up, but we have a lot of people in Pennsylvania that just rely on Social Security and have very little retirement income in other places. So this $350 is, in my opinion, is huge to keep them in their home as long as possible.
I agree. It covers so many different things for so many different people. That $350 may not seem like a lot to all of us, but to them it really is life-changing.
Yeah.
And just in terms of scale, homeownership in Pennsylvania is primarily for individuals who are 50 years of age and older. So the vast majority of people who are paying property taxes on their homes are older adults. So this is a pretty significant investment by this administration in supporting people's ability to be able to stay in their homes.
Well, Go ahead.
No, I was just going to add. There's always a saying out there that individuals are house rich and cash poor. So they own their house outright, but they are constantly having to pay for it. But they have limited income or savings to be able to keep up with the improvements in their home and then their property tax issue.
Let's talk some more about the governor's budget proposal and consider, how does the budget look in general for your entire department? Give us the view from 20,000 feet, as they sometimes say.
Well, we're very appreciative. This is a real investment in the work we do. This is a real investment in the services for older Pennsylvanians. Knowing that we help manage services for the fastest growing population in the Commonwealth, it's a good feeling to know that the administration has put an emphasis on making sure we continue to invest in the services that we do to keep people in their homes and their communities.
Yeah. I think that Governor Shapiro, as well as the legislature, are looking out for older Pennsylvanians right now. There's a lot of good pieces in the governor's proposal that we're pushing for. So I'm excited about this year's budget when it comes to older Pennsylvanians.
Before we move on to any other important issues here, Jason, I want to take just a couple minutes to explore your background. Now, I know you have a background in human services, so tell us about other relevant positions that you've held.
I come from Lackawanna County. I come from Scranton, Pennsylvania, and I started off at the very bottom. I was a county caseworker and worked my way up through supervision and management positions to administration. At a point in my career that I was looking to expand, the county administration and the county human service director asked me to consider becoming the director of the Area Agency on Aging in Lackawanna County, and it's a role that I filled, and I completely immersed myself in, and quite frankly fell in love with the work. It's a passion of mine. It's something that I came to later in life, but it's work that I don't think I will ever be able to not do as I progress through my professional career. I've truly loved the space. I truly love the work that we do and the impact we have on the lives of so many individuals. I joined the Shapiro administration. I was honored by the nomination from the governor. As someone who's been respected, who's worked their way up through the ranks, and I went through the confirmation process, and I was successfully confirmed just last week.
Do you remember day one as a caseworker? I bet it was an eye-opener.
I do remember day one as a caseworker. Yes, very vividly. It was life-changing. Yes.
What'd you see? Who'd you meet? What'd you witness?
What did I see? Remember, I was a county caseworker for the Office of Youth and Family Services. So what I saw was I had to go to a home and get a truant 15-year-old out of his bed and get him in a car and get him to school. I then went and took a mother and her young children to get groceries because they had food insecurity issues. And then we went to visit several foster homes. The first time I had ever been in a foster home, and really had an eye-opening experience as to really the different kind of life those foster children have, and the importance of the work that foster parents do.
And I think the piece here is, I just want to add my 2 cents, is that Pennsylvania should be very proud of the fact to have the secretary here, as well as Kevin. I think Governor Shapiro is right on with regards to having this leadership for older Pennsylvanians as we move forward, looking at this master plan, making sure that we know over the next 10 years what we're going to be doing, what are the resources that we need, and I think these two gentlemen are the right people to lead it.
Jason, a minute ago you mentioned food insecurity. So how do we define that? And how do we know it when we see it? Because after all, if we attach a definition to it, maybe you're in a better position to address it.
Well, food insecurity is, and think about it in terms of 3 meals a day. If someone doesn't have the resources to have 3 meals a day, they're food insecure. Okay. Or if people are making choices and giving up one of the 3 meals a day for something like medication, or even something that's very meaningful to an older person, or a lot of folks, pet food. If people are making sacrifices that require them to give up a meal a day, they're food insecure. In a country such as ours, in a commonwealth such as ours, we can make sure that does not happen, that we have the resources to make sure everyone has what they need to eat every day.
Just to add to that, Pennsylvania is unique when it comes to food insecurity, not only for the reasons the Secretary mentioned, but also because in some regions of the state, there are barriers to being able to access food, including transportation and geographic barriers as well, because people live in rural areas. Pennsylvania is one of the states with one of the highest rural populations across the country, and getting to where the food is sometimes a real cause for food insecurity. So we're hoping through the master planning process to focus on issues like transportation, especially for rural areas, to potentially address this specific issue.
And what's the department doing currently to address food insecurity?
Well, we do operate an in-home meals program that's operated through the 52 area agencies on aging with many, many partners throughout the Commonwealth. But we also have a congregate meal program and a grab-and-go meal program through all the senior centers that exist. There's 485 senior centers in this.
Do these programs include volunteers?
All these programs include volunteers.
Sometimes it's difficult to get volunteers these days.
It's absolutely very difficult, and we really rely on older Pennsylvanians to be our volunteers. Most of the volunteers that we have working in these programs are retired individuals that give back tremendous amounts of hours to our communities. In fact, there's multiple programs at the Department of Aging that rely solely on volunteers to be implemented so that we can make sure that people have what they need.
And right before the pandemic, I just want to say that a Meals on Wheels program is unbelievable around the Commonwealth. And I was lucky enough to be able to do it. I was a passenger, helping out, handing out the meals up in Lackawanna County, as a matter of fact. And it was just eye-opening, just the interaction. So
yeah, what did you see, Bill? Tell us.
So basically, you're there, you're delivering the food, which, I think each one of these individuals was so grateful for. And at the same time, you're also there, you're also seeing how are they doing this day? Did they take a fall? Did they not answer the door? Did they look bruised up? Do they look emaciated? Did they mentally, how were they? Type deal. So you can report these things back to the area agency on aging. If you think that someone needs to be coming in, you need a caseworker, just to check on the person, type deal. So I think yes, we're talking about food insecurity, but we're also talking about social isolation and making sure these individuals are part of the community. Even though they're getting their meals delivered to them, and most of the time they're spending in their homes.
And that's a great point. And also, all of those services really, again, rely on volunteers. But we do have programs like the Senior Food Box program also in partnership with the Department of Agriculture and the Farmers Market Voucher program. Two very important programs that help get 1 boxes of food to food insecure individuals, and also the fresh produce voucher that's incredibly impactful and very popular throughout the Commonwealth for both the farmers and for the older adults that participate in the program.
Another program to highlight would be the Community Health Choices program, which is the Medicaid-funded long-term services and supports program. If individuals are eligible for Medicaid long-term care and are still in their communities, they also have access through that program for home-delivered meals.
Bill mentioned the pandemic just a minute ago, and that reminds me that the County Commissioners Association praised your efforts for addressing the COVID-19 pandemic. So try to summarize your approach. What did you do?
We took a very much a community-focused approach. We had community partnership. We relied on small pharmacies. We relied on nursing students at all the local universities. We relied on our tried and true partners such as the United Way and United Neighborhoods and Neighbor Works, all partners that were community partners throughout all of our history as a human service entity, rallied together and got this done. And not to mention that the county commissioners and the administration in Lackawanna County took a very proactive approach and put dollars behind their words and made sure that there was resources committed to getting as many individuals vaccinated as possible. And we saw at a point that we were at a 95% of individuals over the age of 60 in Lackawanna County were vaccinated, and very quickly. And it was something we were very proud of.
That sounds extremely high, 95%?
Yes, we were the third highest, and we were the only county that had done this without a Department of Health.
Now let's go back to your confirmation. You said recently you were confirmed, and you're confirmed by the Senate. And for people who aren't watching that kind of thing, watching these confirmation hearings, start at the beginning. Basically, what is the purpose of that hearing anyway?
The confirmation process is to make sure that the governor's choice is a good choice. And so, when we prepare for the confirmation, we meet with every senator. And I'll tell everyone who's watching.
Is that right? That's a lot of meetings.
That's a lot of meetings. But they're incredibly important meetings, and the senators took them very seriously. They sat down, they talked, They talked about issues with their constituents. They talked about issues that were facing all Pennsylvanians. They're really focused and energized and supportive of building out a master plan as well, to make sure that we have this roadmap to see that in the next 10 years we'll have a plan for people to age in place. It was an incredible process to meet with them all, to talk to them, have really meaningful dialogue, and then come before the committee to answer their questions and to make sure that they were assured that the administration had made the right choice in leadership to bring the department into the new era and to make sure that we get this master plan completed.
So given these meetings you had with senators before your confirmation hearing, that prepared you for some major subjects that were going to come up. So what did you learn from the senators that you knew you would head into the confirmation hearing prepared to answer?
I learned from the senators that they're focused on many of the issues that we've already talked about today. They're focused on in-home services and the direct care workers shortage. They're focused on property tax and rent rebates for individuals. They're focused on making sure transportation works and food insecurity doesn't exist. A lot of what we've covered today are their focuses, and wanting to make sure that people can stay in their communities, people live in their homes. That is their focus as well. They want people to continue to live in their homes for as long as possible or forever.
And I think one of the other pieces too is that one of the stats that I keep on hearing is that by 2030 we're going to have 1 in 5 individuals over the age of 65. And I just think again with what the Secretary went through this process and what Kevin and the Secretary are doing with the Master Plan on Aging, just fits right in. 1 in 5. I mean, it's just huge, and we have to make sure we have the infrastructure in place, 10 years out, that are going to be able to support this type of growth within the 65 plus population.
Let me return to food insecurity just briefly, gentlemen. I figured we'd be remiss if we didn't talk about SNAP, which is the Supplemental Nutrition Assistance Program, and who can just explain the bare basics there and who qualifies?
Sure. So,
Kevin, you have the job.
That's right. Look right at him.
I'll do my best. SNAP is meant to be a supplemental food provision program. It provides benefits to adults who qualify based on certain levels of income. Why it's of particular attention currently is that the benefits were expanded pretty dramatically during the public health emergency, and because the public health emergency is ending, effectively has ended. Right. There's a pretty significant drawback to what that benefit will be made available for people. So the concern right now and the focus right now, and it's a concern for multiple agencies under the governor's jurisdiction, is to support gaps that individuals may have when it comes to providing a nutritious life, and to make sure that this change in levels of benefits doesn't negatively or dramatically negatively affect the health and safety of individuals, including older adults and adults with disabilities across the state.
So with COVID-19 in the rearview mirror, for the most part, SNAP payments are going back to what they were?
That's my understanding, yes.
Yeah, and they weren't that much to begin with.
Right.
What we've been hearing from some of our members is we just got a call in the other day, and someone went from $85 a month down to $35. So I don't know, first of all, how you can eat on $85 a month, but going down to $35 is just, so we have to make sure, as Kevin just said, make sure that the administration, the government is there to support these individuals when we're coming out of COVID, and making sure that they can, again, stay in their homes as long as possible. And part of that is being able to eat and feed yourself. So,
and let's take a step back and consider about how many older Pennsylvanians are counting on SNAP just to get basic nutrition.
There's thousands. There's thousands. I don't have an exact number with me today, but there's thousands of Pennsylvanians that rely on this and all the other food programs that we have throughout the Commonwealth. And with the cost of living increase in Social Security, there is that fear that they are going to be no longer able to qualify for the SNAP benefits. So that's why it's important that as a Commonwealth we continue to focus on making investments in this program and making sure that we cover the gaps that have been left for some of these older Pennsylvanians.
I'm sure some of our viewers are starting to think about Medicaid for the first time. So again, start at the very beginning. What are the basics? What does the program offer?
Want me to go with that one? So Medicaid in Pennsylvania covers roughly 3 million individuals. There are 3 different components to the Medicaid program. There's physical health services, which is acute care, hospital-based care, doctor's office visits, pharmacy. There is behavioral health services. Behavioral health services cover those treatments that support people with some sort of a challenge related to depression or other behavior-related diagnoses. And then there's long-term services and supports. Long-term services and supports are, as I mentioned, like the Community Health Choices Program. They provide services like nursing facility services and home and community-based services or facility-based services and home and community-based services for the intellectual disability population. Those services are supporting activities of daily living and underwriting a person's daily conditions to be able to maintain as healthy a life as possible. There's an eligibility component that's associated with the Medicaid program, and the reason why, once again, it's significant in this conversation is that there was a moratorium through the public health emergency on Medicaid eligibility redeterminations.
Redeterminations,
which means that every year somebody who's in the Medicaid program has to go through an eligibility redetermination. It's very different from Medicare. When you're eligible for Medicare at age or based on a certain type of disability, you're usually eligible for life.
Right. You have it and you keep it.
Right, and you don't go through an eligibility redetermination. It's age determined. With Medicaid, it is income determined, so they validate your income level on a yearly basis. During the public health emergency, the 3 years of COVID-19, there was a moratorium on that process. That moratorium is being lifted as the public health emergency ends. So everybody in the Medicaid program across the country will be going through an eligibility redetermination process. This administration is taking a very thoughtful approach.
So they'll be reassessed and they'll stay on the program, or they're off.
Or they're off. And we have a year based on federal guidelines to be able to go through the eligibility redetermination process. Department of Human Services is leading the effort. And once again, all state agencies that work with these populations will be supporting that effort as well. And the effort here is to make sure that people who are eligible for the Medicaid program will have no interruption in services based on this process.
Now, under Governor Shapiro, what does the Medicaid program hold for the future? Has he indicated anything publicly?
Well, the Pennsylvania Department of Human Services oversees the Medicaid program, and I would be remiss if I didn't make sure it was clear that we wouldn't be speaking for them and talking about their own initiatives.
Sure. Okay.
But the Department of Aging and the Department of Human Services are strong partners in supporting the populations that overlap between the two agencies, and that includes older adults and adults with disabilities. So the Department of Aging and the Department of Human Services work together to make sure that the supports needed through the Medicaid program or otherwise are addressed in as holistic and as complete a way as possible. Speaking to the future of the Medicaid program would be more under the purview of the Department of Human Services, but whatever that is, we're here to support them.
But I think just going back to the master plan on aging for a second, this is something that will be looked at, because I think the Secretary and Kevin, as he talked about getting as many stakeholders as possible. They're not just talking outside of government, they're talking within government as well. So the Department of Health, Department of Human Services, DEP, and Department of Environmental Protection, corrections, you name it, across the board will be having input into the master plan, so that, these issues that you talk about, like what does the future hold for Medicaid, hopefully we'll find that out. We'll get to know what individuals need as we move forward, and we'll come up with that 10-year plan.
We often hear from our viewers about property taxes, and we already explored that in some detail. So let's move on to another, I'll call it like a perennial concern amongst our viewers, and that's the cost of prescription drugs. How well are older Pennsylvanians dealing with the cost of prescription drugs?
I think prescription drugs is an ongoing challenge, but I think that we have programs like our PACE program. Our PACE program does an incredible job helping 250,000 people a year with prescription coverage. I mean, that's a big number. I think Tom Sneddon and his team do an incredible job making sure that we have gap coverage, and the moratorium that was just passed, the Senate bill that was just put forward, will cover 20,000 Pennsylvanians that are going to be experiencing a gap in their coverage. So I think our PACE program really helps us elevate that problem and also solve those issues and make sure that people have the prescriptions that they need. And we want people to reach out to us and continuously make sure they're, reaching out to get the coverage. And we have partners with AARP that help us too, keep people connected, keep people getting the medication that they need to live every day.
And I think the key part here too is the Secretary's right. The Department of Aging, under the leadership of Tom Sneddon under PACE, has done an outstanding job of really getting as many people on as possible onto the prescription drug program, the PACE
There's at
program.
least two levels of PACE, right? PACE 1 and PACE 2, do they still have that?
It's PACE and PACE-Net.
PACE-Net. Right.
That's okay. So I just think that's great. But I think the key thing here is also education. And I think the Secretary kind of just talked a little bit about that, making sure that Pennsylvanians know that this program is there and that they can sign up for it. And the Department of Aging makes it so easy for them to go on and be able to sign up for these programs and to see if they're eligible or not.
Now, we've already touched on aging in place, and that seems to be a phrase that has a growing popularity recently. And so let's really dig into that and explain what it means first.
Well, aging in place is it's a concept of making sure people can stay and live in their communities. But aging in place services really focuses on making changes to an environment so that an older adult can be safe. You look at aging in place services. It could be a bathroom modification. It could be installation of grab bars. It could be a ramp for someone's home, okay, or a stair lift for someone's home. A lot of those aging in place services or aging in place programs revolve around making sure individuals have those necessary modifications. We call them critical safety modifications, so that they can stay in their home. And some of them are less complicated than others. Making sure that doorways are clearly marked and glow strips on stairways to make sure people don't fall. All of those things are services that are and ways that we keep people safe in their homes and that they can stay in their homes. And it really expanding those services helps us make sure that people who don't necessarily need some level of in-home assistance because a modification can correct what their need, don't have to rely on a continuous strain on the direct care worker shortage. So with the modification, an individual might no longer need someone to come in their house and do personal care, and that personal care worker can go on to someone who has more significant needs that even a modification can't assist.
And I think the other piece of that is above and beyond all those great pieces that the Secretary just talked about, is also the financial pieces. So what we're talking about, the property tax and rent and rebate, having those extra dollars coming in will keep them aging in place and where they are. Being able to talk about transportation, being able to talk about some other pieces, even livable. We talk about livable communities, making sure that an individual is able to walk along the street without tripping over cracks or different pieces in the sidewalk. Again, all of that to me is aging in place. It's livable communities. I hate to go back to it again, but I think the Master Plan on Aging, as we look at this for 10 years, will encompass all of these issues to make sure that we're looking out in the best possible way for Pennsylvanians as they age.
Right. You had mentioned earlier what we think will be some of the priorities that will come out of this master plan stakeholder engagement process. We're making the assumption that all of what Bill had highlighted and all of what the Secretary had highlighted about supporting individuals' preference to be able to age in place in their homes and communities will be a pretty significant discussion point for the master plan.
And I think the conversation today highlights the importance of stakeholder engagement for us, because when you hear a term like aging in place, it means so many things, but it means something different to me than Bill. But both of those things are correct, and that's why it's important to have the level of stakeholder engagement that we are asking for to build the master plan, to make sure that we hear everyone's voice so that it's comprehensive and it's practical, and that it's something that lives with us for the next 10 years and evolves over the next 10 years to meet ever-changing needs.
So stakeholder engagement, Jason, you were talking about that, and Kevin, you used the word preference a minute ago, and certainly that's to be considered because we've established that a lot of people have the desire to stay in their own home. but what limitations might aging at home put on opportunities to socialize? That's an important thing to consider.
That's a very important question. Social isolation exacerbated during the public health emergency during COVID-19. There's been a lot of research and growing body of research that demonstrates the long-term physical health and psychological negative consequences to that have occurred because of the social isolation that came out of COVID-19. But social isolation pre-existed COVID-19, especially for people living in their homes alone in their communities or having limited access to that type of community engagement. AARP has an age-friendly designation that pays a lot of attention to components for social engagement as an important social determinant of health, both physical and psychological health and well-being. And we know that it's likely going to be an issue that's raised throughout our discussions for stakeholder outreach for the master plan. And we also know it's going to continue to be an important point of discussion for anybody who has any type of interest or engagement with older adults.
I think the other piece too is that, we have 52 area agencies on aging, and I think it's important to let people know that the area agency is there. I always hear that people go to the area agency, and probably, the Secretary could talk better about this, when they're in crisis. Family members in the hospital, can they go back home? Where do they need to go?
Right.
And that's when they interact. But the area agencies on aging have so much more that they can offer. And social isolation and making sure that people can come out to different events, to senior centers, to get them out of their home, get the transportation to get them out of their home. So the area agencies on aging are really there on an everyday basis.
And you asked what has changed since 1963. And we look at, for better than 50 years, senior centers have been the front line in combating social isolation. We didn't call it social isolation, but that's really what they were doing. They were keeping a connection point for people to come and socialize and congregate and make sure that, people were taken care of. But the world is changing and there's a bigger demand. And that's why we see an expansion of programming. And we see older adults asking us to do programming that brings them outside and expands to, pickleball and other, nature-related activities. In my previous life as an area agency on aging director, some of our best programming came from working with small nonprofits that took people on hikes and did beginner kayaking. And they were popular, and gardening. And they're the things that people are interested in, but they're the things that help
Recreation, hobbies, activity.
And keeps people connected. And it's a good way to make sure that we're doing everything we can to combat social isolation and behavioral health concerns.
And just a plug for one of our sister agencies, the Department of Conservation and Natural Resources. They are heavily focused on engagement and recreation activities for older adults and adults with disabilities. A lot of their local programming for parks and recreations and a lot of their statewide programming for the state park system and elsewhere really is focusing on that community engagement for these populations.
I'll be with the acting secretary tomorrow, as a matter of fact, talking about older adults and behavioral health concerns and making sure that we make the connection onto what we can offer as a Commonwealth for people for recreation.
Bill mentioned just a few minutes ago livable communities. That's another phrase I like to zero in on and get a definition. Well, we've established so far that a livable community, one aspect of it, is that you're able to walk around it. So are community planners answering these concerns today as they lay out the communities for tomorrow? Or are we making responsible progress in your minds about making these livable communities? Yeah. It's infrastructure, isn't it?
It is. It's so livable communities, again, livable communities aging in place, intertwined with each other. The bottom line here is that I can say that in Pennsylvania, I'm very pleased to say that a lot of local communities, cities, municipalities have been working on livable communities. They've looked at, they get the planners in, they work with their city councils and with the mayors to be able to say, do we have safe streets? And when I say safe streets, we talk about bike lanes, we talk about intersections, we talk about curb cuts, we talk about lighting, at stoplights. Is it long enough for someone to cross over if they have a disability? can they make it across the street before they have to worry about the light changing? We talk about open spaces. We talk about parks and recreation, as we did earlier here. We talk about, in urban areas, we talk about, transportation, like SEPTA, down the southeast. But then also we talk about it in rural areas. What does that mean, for transportation when someone ages and they can't drive anymore? How do they not become socially isolated? How do they get out of their homes? Again, livable communities are all pieces of that, as well as housing. We talk about the housing stock. What does that mean? So for someone in Pittsburgh or in Philadelphia living in a row home, you have your bedroom up on the second floor. We go back to what the secretary was talking about, modifications. How do we get them up to their bedroom, or do we reconfigure the house to make them age in place in a livable community? So those are all pieces of what a livable community is. And I think in Pennsylvania, we've been doing an excellent job of being able to focus in on that and making sure that people are able to stay in their homes as long as possible.
So what about the problem of homelessness? And of course, as far as this program is concerned, how much does it affect our senior population here in Pennsylvania?
Unfortunately, we see a growing trend in older adult homelessness in all pockets. Not just the big cities, and not just we're seeing it in urban areas. We're seeing it in rural areas. There's a change in real estate in the Commonwealth. We see people neighborhoods being gentrified. We see people being pushed out of their homes. Right. We see rents going up. Another reason why the property tax rent rebate program is so important, because that rebate can help keep someone in their home just a little bit longer while they look for more affordable housing options. So we see it as a growing trend. We're working with sister agencies and other municipalities and the 52 area agencies on aging to look at what kind of programming we can do to really combat this, because a lot of the numbers that you see are not necessarily people living on the streets. You see older adults couch surfing, and you see older adults moving from place to place and staying in their vehicles because they don't have adequate housing available to them.
Now, on the subject of collaboration, it makes me think that certainly some of Pennsylvania's homeless are veterans. So it occurs to me to ask you, is there any kind of collaboration between your department and, say, the Veterans Department to help address special needs veterans might have?
Well, honestly, at my very first cabinet meeting, I told every cabinet member that I would be intersecting with all of them, and that is the truth. Not just with the master plan, but in all that we do. So obviously, veterans is a very easy partnership for us because of the people that we serve. But again, we would never have thought that banking comes into heavily with us because of protective services, and we work very closely with insurance because of PACE and other programs we do. So again, every cabinet member, every one of them works on issues that better the lives of older Pennsylvanians.
Including veterans.
Oh, right. And before we close our program, gentlemen, we still have a few minutes left, but let's consider as the lifestyle, and we'll make a full circle here, lifestyles of older Pennsylvanians change. Again, how do we continue to adapt to their needs? And as far as your, what did you call it, your master plan is concerned?
It's not my master plan. It's theirs. It's Governor Shapiro's.
It's all of ours.
It's all of ours. But I think transparency. I think being able to go out asking everyday Pennsylvanians what their needs are now and into the future is key with me, and making sure that every stakeholder has a say in this master plan, because it's going to impact them. It's going to impact the legislature. It's going to impact policy. It's going to impact individuals, organizations that work with and take care of older Pennsylvanians and those with disabilities. So I just think, to me, making sure that we reach out and get every corner of the Commonwealth covered and finding out what their needs are, whether it be urban, suburban, or rural, is key.
And the only thing I would add to that would be focusing on every not just focusing on every corner of the state geographically, but every individual who wishes to contribute, regardless of age. We want people to think of this plan not just a plan for older adults and adults with disabilities, but a plan for everybody, because if we're all lucky enough, we're going to all be older adults living in Pennsylvania, and this plan will hopefully reflect the needs and preferences for everybody, regardless of where they live, regardless of their income status, and even regardless of their age, as they think about and plan for older adulthood.
As my colleagues have said, this is not a Department of Aging plan. This is a plan made by Pennsylvanians for Pennsylvania. And we may be the convening department, but we really need everyone's help and we need everyone's input to build this out correctly so that we have something that we can look to for the next 10 years that's going to get us what we want. And that's what we want, is for people to be able to age in place, live in livable communities, with dignity, respect, and happiness, and be able to make the choices that they want with the services that they need.
And we've established that there are plenty of services out there, and yet there's an effort to improve access to these services. In other words, people have to know they're there. Talk more about that.
It always amazed me how much an area agency on aging does. When you look at the breadth of the services that they provide, and that really, very few people in the population know that they can just access them as the front door to all services. And
is this an office you can just walk into?
It's in most counties and most municipalities, yes. There's walk-in, you walk right in, and someone will help you. And there's always literature, there's always information, there's always someone to make sure that you get. I mean, they do go home at the end of the day, but we still have.
Okay, I'll give them that. They can go home, go to bed like the rest of us.
But in emergencies, there's 24/7.
But the point is, you have humans there when you walk in.
That's right.
Which is refreshing nowadays, I have to say.
It is. And because of the population that they serve, it's important to make sure that someone can walk in and sit down and have a conversation and make sure that someone has their needs met. But we are on a continuous effort, and our communications department and the governor's communications department and partners like AARP are always out messaging to make sure people know the resources are there, to find different avenues to make sure we communicate to people that we have services available, and that there's people really at the end of that phone willing to help them with their everyday problems and make sure that they have what they need.
So which services or resources do you figure are really underutilized? Now's your chance to get the word out.
We were talking about SNAP earlier. A lot of older adults are eligible for SNAP benefits. Even though the benefits will be lower than they were during the public health emergency, there are a lot of older adults in Pennsylvania who are eligible for SNAP.
You should apply and see if you're eligible.
Right, and the area agencies on aging are a good resource to be able to know how to navigate the system for eligibility.
Another underutilized program is adult day services. We see a trend of people are moving away from adult day services, and that is a very powerful and impactful program that helps people with either respite, or it helps people with making sure that they have an alternative so that their loved ones can stay with them longer. It really impacts the life of a caregiver and a care recipient equally, and it's oftentimes underutilized and overlooked.
I think just to add, because it is current in the budget right this second, it's the property tax and rent rebate. People don't know that they're eligible. They don't even try because they're like, I think I make too much money, or I'm not eligible for that.
You have nothing to lose by applying.
Right, and the same thing with the options program. I just think, if you, that's there for those that are not on Medicaid. That's for the higher income individuals. It's a sliding scale fee. I think it's key that people, be able to do that and go and know that these programs are there.
Our guests have been Bill Johnson-Walsh, State Director of AARP Pennsylvania, Kevin Hancock, Special Assistant to the Secretary of Aging, and the Secretary of Aging, Jason Kavulich. Thanks, everyone. That's it for Focus on Aging Adults. I'm Larry Casper. Thanks for watching.
Our story begins more than 60 years ago inside an abandoned chicken coop where our founder discovered a retired teacher living, no home, no health care. So she said no to this injustice and yes to transforming lives. It's this drive, this compassion that inspired AARP. Today, we empower people to choose how they live as they age. We advocate for health and financial security. We strengthen communities everywhere. We are AARP Pennsylvania, creating real possibilities.
Focus on Aging Adults is sponsored in part by AARP.